the aging adult. This meeting is being recorded. Thank you. So yes, what's up with aging? Why is this an issue? Well, this is nothing new at all. Um, However, as we get older, oh, there we go. Oh, wrong one. It's not sharing. Huh. And share. All right. So, uh, gosh, misconceptions, myths regarding aging have been around for ages. Each generation probably. Um, so there's a few questions here I put on the opening slide. Are older individuals interested in the outside world? Obviously, they are. Obviously, we are. Are older individuals interested in relationships? Of course, they are. Do they contribute to society? Absolutely. Are they set in their ways? Not necessarily. Not necessarily. And there are other such questions that we're going to try to tackle. Of course, not all of them. There's so many that have been asked and continue to be asked that we're just going to cover a few today. Let's see. All right, let's make the show go. Okay, here are a few words about aging that seem popular, and there are many more slides that look like this. But the question I ask, are they accurate? Are these words accurate about older individuals, or are they just simply labels that we've come up with to identify our perceptions of being old, like cranky, out of touch, senile, childlike, oldies, elderly? These seem more like labels than actual truisms about us as people as we age. So, our perceptions. Well, and these numbers are updating all the time. I got these numbers from a link that the article was about 7 years old, so I'm sure that the numbers are greater, but about 10,000 people plus every day are turning 65 and older. And I'm sure those numbers are larger and larger. So the Reference Bureau for Populations estimates that people over 65 will make up about 20% of us as we get closer and closer to 2030. And that's probably true, but I imagine by the time we get to 2030, we're if we aren't already involved in the silver tsunami, as a term is used, uh, we'll be greatly into that silver tsunami by 2030. I'm pretty sure. So what do we think of when we talk about aging? Well, we tend to think about slowing down, napping, pains here and there everywhere. I got to sit down more, or I'm too old for this. There's that term that I used to hear all the time. In fact, it's used in movies all the time, only with the term shit at the end. I'm too old for this shit anymore. I can't. So that's a very popular set of that's a very popular term, um, or sentence rather. Uh, so with that though, when we tend to think about some of these terms that we use, uh, where we're using our own personal references, and everybody does that, to stereotype. I want to call them their biases, stereotypes, your own perceptions, but uh, they end up in the end being misconceptions because not all people are the same. And that goes in different age groups, or every age group. not all people within those age groups are the same. They aren't. We aren't. We have differences. Some of us age different, and it's true. Some of us age better. Some of us age maybe not so much better. Some of us think like we're younger. Some of us think older when we're younger. We're all different that way. uh, Contrary to popular belief, there is no typical older personality. I used to think when I was younger that most personalities were like my grandparents and then later on like my parents, but that's not true at all. It's our personalities are formed early on in our, in our development as people, and becomes modifiable and malleable throughout our lifetime, throughout our span. But some of these ideas we have to examine within ourselves, because we have to change our own perceptions about aging, and in that people in the aging demographic, older between 60 and 70, 70 and 80 as time goes on. You might see, I remember a class I took in gerontology years ago. We were shown on the screen faces, and we had to take a quiz. How old do you think this individual is? Because our perceptions by what we see, we all had different ideas, it seemed, about how old we thought this individual was. And sometimes we were right, a lot of times we were wrong. So that blew a huge stereotype that I had about people and aging. Made perfect sense to me. I said, boy, I've had some wrong ideas about aging and the elderly. And that class I took almost 20 years ago. So yeah, I was younger. My perception now is different, and continues to change all the time. So here's a short video if I can get this to work. Okay, I think I can do this by pressing Control and click. Is that right? Control, or is it? Shoot. Ivan, this told me before I could do this by pressing Control click. Am I having a problem, or does it need to be done on that one?
This is just what we can see.
Or is it something in the video that I did not? Shoot.
Okay.
It's only a minute and a half. Maybe if I go, can I go to YouTube? Control click? Or I don't know. This comes right off of the website of the National Institute of Aging, in fact. Let's see. Should be able to pick that up. Okay, good. Can we go to YouTube? Will allow us to do that? Oh, browse YouTube. There we go. Now let's see if it'll play. Uh-huh. Oh, I guess we need to start it from the beginning too, huh? Oh.
Exercise. Research shows the benefits of exercise go beyond just physical well-being. Physical activities like walking, biking, dancing, yoga, or Tai Chi can help.
Sorry, folks.
These can reduce feelings of depression and stress.
What did you do? Perfect. Okay, here we go. Starting this from the beginning.
The emotional benefits of exercise. Research shows the benefits of exercise go beyond just physical well-being. Physical activities like walking, biking, dancing, yoga, or Tai Chi can help. These can reduce feelings of depression and stress. enhance your mood and overall emotional well-being, increase your energy level, and improve sleep. To learn more about the benefits of exercise, visit www.nia.nih.gov.
How do I? All right.
Escape.
Escape.
Just
Oh my gosh, thanks.
And then you go back to the PowerPoint. You press present.
Oh, this one?
So present from current slide.
Oh,
Do you have another video that you want to show?
I do. I do. I have
Just
another
watch
one.
it instead of, yeah,
Should I just go right to this one?
do the best.
Oh, okay.
And then control click it.
Control. All right.
Press browse YouTube.
So, all right.
Can you see it? Do you see it?
Do I
Play it.
play it? Can I expand it, make it full screen?
Sure.
Is forgetfulness normal or not? Many people can become more forgetful as they age. How can you tell the difference between mild forgetfulness and serious memory problems like Alzheimer's disease? What's typical and what's not? Normal aging includes making a bad decision once in a while, missing a monthly payment, forgetting which day it is and remembering later, sometimes forgetting which word to use, losing things from time to time. With Alzheimer's disease, people experience making poor judgments and decisions a lot of the time, problems taking care of monthly bills, losing track of the date or time of year, trouble having a conversation, misplacing things often and being unable to find them. Although some forgetfulness comes with age, don't ignore changes in memory or thinking that concern you. Talk with your doctor if you notice you have more serious memory problems than normal. For more information about forgetfulness and memory loss, visit www.nia.nih.gov.
Okay. And pause. Right? Whoops.
Escape again.
Okay. Oopsies. Escape.
Now to PowerPoint.
Okay.
Present from current slide.
From current slide.
Then share the screen again.
Oh, shoot. Okay.
New share.
New share.
And then
Which one?
let's use the slideshow here.
Okay. All right. And I want to advance it. Okay. So those were two short videos about, yes, the first one was about emotional, I want to say contributions to emotional health, but also to exercise benefits the entire person, all the way into and through aging. That was why I showed that one. And this one here, forgetfulness, the big difference between normal forgetfulness that occurs and then something that sets in that becomes not just chronic, but can worsen and worsen. And that's Alzheimer's dementia, a different diagnosis, a different condition altogether. So the normal forgetfulness and disease, two different things. So here's some myths. Well, we're going to get into it here in a minute, but I think we make assumptions again about aging and what it's like to grow old. I have my own assumptions. I have my own perceptions about how I'm aging and how others around me, how my wife is aging, acquaintances, how other people are aging. We all have perceptions and certain biases too. But there are positive aspects to aging too. A lot of us may not think about that, but and this is where the class and brain and gender differences, we talk about what, the difference between something called learning and what's conferred by a college degree, and something that happens over time, over and over and over again from repeated use and doing, that turns into wisdom. And I'd like to think that with age and experience, and the older we get, the more experience we have, that there's some wisdom that comes with it. And so that's kind of what I didn't used to see things that way when I was younger. Now, as I'm getting older, I'm starting to see things that way, much more so than I used to. And so we still make certain choices like we do when we're younger, that lifestyle choices, learning, staying healthy in one way or another, staying current with news and whatever it is you're reading. We still do that. Healthy habits, healthy lifestyle choices. We can do that all the way through the different passages of life. So here's a myth. Number one, depression and loneliness are normal in older adults. Is it true? Or is this just a myth? Is this just a perception? So the truth is, as people age, it depends on what's going on. Depression, isolation are not normal no matter what age you're in, okay? At any age group, we can feel depressed, isolated, anxious, sad, all of these things. But these are not a normal part of aging, okay? If what seems to impact this more is what kinds of relationships you have as you get older. What you do to, as you maybe did when you were younger, to keep yourself busy and active. Okay, so you're not feeling isolated, you're not feeling lonely, you're not feeling depressed, and maybe less anxious because you're doing things that keep you involved some way, like say here at the cardiovascular wellness center. So it depends, like at other stages in one's life, what you're doing at the time proactively. It doesn't necessarily mean as you get older, your mood, you're all of a sudden going to change into this depressed, cranky old individual who's got a temper. No, no, no. That's not true. That's not true by a long shot. However, if you deal with serious depression earlier in life, or serious anxiety disorders, unless they're effectively treated and they're effectively dealt with when you're younger, if they are, then that will actually translate to a normal sort of aging process. If not, it can lead to troubles later on as well. So it just depends. But people, as we age, don't automatically become depressed, anxious, feel isolated, or their mood changes abruptly at 65 or 75. That's not the case at all. So that's one. Now, the older I get, the less sleep I need. That is not necessarily true either. The truth is, we may find ourselves in a situation where it may be harder to get to sleep. However, we do need to have rest, and everybody's different about that too. And that's according to one's sleep needs. And they may decline as we age. But we do in general still need the same amount as everyone else, say somewhere in the 7 to 9, which is kind of a loose range. You may not need a full 7, you may not need a full 9, but you may need a little bit more in some cases too. So we need sleep in order to repair. The body needs that to repair. There's a whole set of processes goes into emotion when we sleep to get rid of free radicals in our system, to repair. And our memory gets rejuvenated while we sleep as well. So everybody needs that, whether you're young or old. So hopefully that makes sense. All right. Older adults simply can't learn new things. You can't teach an old dog new tricks. I remember hearing that as a kid all the time and thinking, does that mean that old dogs can't learn new tricks? Or does that mean people, when they're old, can't learn to do things? You know, because that saying it was everywhere. But the truth is, it's not true. We have the ability to learn throughout life. We can still make connections, and that's called neuroplasticity, to learn new things. Okay. We can also what's called, well, it's reinforcing, and that's also part of this thing called neuroplasticity, where the more we reinforce those connections for doing a skill, or maybe it's something in memory, maybe it's a task you've done over and over again, and you continue doing it later on in life. Those pathways continue to get reinforced. They don't get severed and cut unless you decide not to do it anymore. And then, of course, it gets pruned and it gets cut. This is something we teach too in brain and gender differences, about what pathways are strengthened and which ones are pruned simply because we don't use them anymore. So now there's some cognitive changes, of course, but they don't necessarily have to be bad, and they're not necessarily severe either. Okay. And this is why, I mean, things like puzzles, reading, I want to say games, even the computer. I mean, you can learn new things about what it is you're doing all the time that's going to enhance the brain and keep you from slipping more and more. I mean, there's all kinds of study that reinforce that view of things. And so it's true. It's true. We can learn throughout life. Maybe not at the same rate we did when we were 15 or 20, but we can still learn at 90 or 80 to do something we think we'd like to learn and do. That's the point. So myth number 4, it's inevitable. All people who are older are going to get dementia. No. Dementia, like some of those other things we just talked about, are not a normal part of aging. The risk of dementia does grow as we age, but it's not inevitable. Okay. And there are many things that we can do as far as lifestyle that will help prevent that. Okay. Exercise, other unhealthy habits of living that, I want to say destroy nerves, blood vessels, and other organ systems in our body are only a bridge, or only creating a bridge to some of these disorders. So we can break that, and we can slow those processes by how we live and what we do. A certain amount of mild forgetfulness is not dementia. It happens, but it is not necessarily a sign of dementia. Older adults should take it easy and avoid exercise. Nothing could be further from the truth. Okay, we all know about cardiovascular benefits of exercising. There are benefits all over the body, one system after another, including the brain. Our joints especially benefit from exercise and use. Absolutely. Preventing severe arthritis, preventing other types of deterioration from starting in the brain. Because as we're pumping blood, we're perfusing blood, oxygen to all areas of the brain. And if we're doing this on a daily basis, those organ systems throughout the body are getting a good exchange of oxygen and carbon dioxide and a good exchange of nutrients and waste products. So yes, 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 exercise benefits at all times of our development. Myth number 6, if a family member has Alzheimer's disease or Alzheimer's dementia, then so will I. Not necessarily. It may be higher since there is a component of, well, there's a hereditary component in the chances and the risk of developing it if a grandmother or a mother had this because of your genes. And that will slightly increase the risk. However, it doesn't necessarily mean you're going to get this. There are other environmental factors, and I mentioned some of the things that you can be proactive on to stave off, some of these, the possibility of a dementia, because Alzheimer's is not the only one. It's one of several different kinds of dementias. I mean, everything from exercise to what we put in our body, exposure to certain pollutants. Well, of course, smoking. Smoking makes for so many damages throughout the body. So there's some things in our control, in other words, and other things that are outside of our control. We control what we can, and we just do the best we can with what we can't control. But it doesn't mean that I'm going to get it because my mother or my grandmother had it. So number 7, now that I'm older, I have to give up driving. Well, that's a matter of degrees and when. Well, yes. So yeah, our conversation earlier, Ben, there's going to be a point where I think all of us will have to give up driving. But does that mean as I reach the age of 65, ding, 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 or 75, ding, 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 I can't drive anymore? No, that's not the truth at all. The numbers of elderly drivers or those who are aging actually are still pretty high. They're at a record high right now. According to the Federal Highway Administration, 221.7 million licensed drivers, at least as of 2016, including those over 65, or I should say 1 in 5 over 65 years of age and older are still driving. So that's not necessarily something that stops when you reach 65 or 70 or 75. That's something that is an individual thing and not simply part because I reached 65 or 75, therefore all 75-year-olds shouldn't be driving, or I shouldn't be driving because I reached that age. Not necessarily. That's going to be an individual thing. Because some of this, as we age, our reaction time slows. Our eyesight changes over time too. Certainly if you have cataracts, those kinds of situations need to be corrected before you're deemed able by, either your physician or the Department of Motor Vehicles to continue driving. And then they may want you to do a driving test, etc. Only women need to worry about osteoporosis. This is something I think men don't think about as much because the risk in women is higher, but that does not mean that men do not develop osteoporosis, because men do. So it is common in women, but in men, it's oftentimes, this may be the reason or part of the reason why it's not seen as much, or at least not noticed, is because maybe it's underdiagnosed for some reason. And they're simply not looking for it. I had to undergo a HIDA scan myself. And what they found as a result of this HIDA scan, which is bone density scan, is that I have a mild form of osteoporosis called osteopenia. So it was there and I never knew it. So the answer to that was to increase calcium intake and vitamin D intake, because they kind of go together for better absorption of calcium. So, however, men and women both have to worry about bone density changes over time. It's not just something that happens to women. And there are, of course, other outside factors. I want to say exercise can help with bone strength. Vitamin D and calcium, adequate amounts of those two, micronutrients are necessary. Vitamins are necessary to maintain that over time. Exercise is very important along with that. Low levels of certain steroids like testosterone in men, especially, go along with, I want to say, the risk of osteoporosis. So that would need to be found out through a lab test and then measures taken to correct. If you're drinking a lot, that is also associated with bone density problems. Same with smoking also. This goes along with certain risk factors that contribute to osteoporosis over time. Because I know my oldest brother, if he was alive today, he'd be 73. He smoked like a chimney, and he had osteoporosis, broke his femur, and then another time broke his hip. He had osteoporosis. His bone structure was breaking down on him. But he smoked all of his life, and that contributed to that, I'm sure. Yes.
It says they keep taking certain drugs. Do you mean prescription drugs?
Some of them may be prescription. Some of them may be non-prescription drugs. This is something too that either you as an individual or your physician, when they prescribe a drug and it has a side effect of either blocking certain vitamins that will, I want to say that you need to naturally have to prevent loss of bone, or there are others that simply contribute to bone loss in general. Right off the top of my head, I can't think of one, but I know there's a few. I just can't think of one right off the top of my head. That might put you at risk. And if it's a medication that the doctor prescribes, then the doctor needs to do something to offset that. And, it's too bad that oftentimes when a physician prescribes a medication, he has to prescribe something else to offset the side effects. It kind of comes with the territory when it comes to that kind of thing, unfortunately. So yes, medications can directly have an impact on that. I know vitamin C, if there's too much of it in your system, tends to contribute to calcium loss. And so that individual has to either cut back on vitamin C or add more calcium to their diet. So it's a delicate balance. But but men don't escape that. If women have trouble with bone loss and osteoporosis, men have it too. And I have a feeling it's underdiagnosed in men. So number 9, I'm too old to quit smoking or some other unhealthy habit. And we know that's not true. We know that's not true. Some of the habits like drinking and smoking are very, very difficult to quit, but it doesn't mean you can't. Okay. Doesn't mean you can't. Um, However, smoking, I've found it seems to be one of the hardest uh, habits to break. And so many times I've seen smokers quit and then go back. Something triggers it, stress maybe, or something else triggers it, and they go back to smoking again readily. They're so used to doing it. Same with alcohol consumption. So some of these bad habits are actually contributors to illness. And so the sooner that one figures this out and comes to grips with it, the sooner they can make an effective, they can address in an effective way quitting some of these habits, even if you're older, And so it's still possible to do that. You still have the willpower and the decision-making process to do so when we get older. I mean, some of these, unhealthy habits can contribute to everything from gut problems to blood pressure problems to nerve problems to lung problems. And you may figure, well, I'm too old. I can't, I'm set in my ways kind of thing. I'm too set in my ways. Well, that's a perception. That's not a reality. That's not the truth by and large. You can still make a conscious decision to change that. You can still do that all the way to your late 80s, 90s. You can still do that. So number 10, my blood pressure is lowered at this point. Gosh, or it's returned to a lower number and I'm okay with that. So I can stop my treatment. Well, the truth is that's not a good idea, because in my experience with treating patients as a nurse in the hospital, usually what happens, you might in fact feel well, but if you stop the medication because you feel well, you might in fact be setting yourself up for a heart attack, or you might be setting yourself up for a stroke, or you might be setting yourself up for a pulmonary embolism or a clot that forms and sticks in the leg and you have a deep vein thrombosis. No, this is where the wise thing to do is to continue taking the medication. If you have questions about how high or low your blood pressure is, then you need to contact your physician and make that conscious decision. Because I've taken care of too many patients who, when older, decide just to stop. And there are consequences that go with that. Even if you feel well, doesn't mean that your blood pressure won't return to a state that's high, because it will, or your heart rate might return to a irregular rate and a fast rate, because it can, and it oftentimes does. So, you have to think about other systems too. That, I remember Dr. Buka Putnam several weeks or months ago maybe talked about high blood pressure and the kidneys. And those two go hand in hand. And same with stroke, brain, heart, kidneys, all affected by high blood pressure. See you, Ben. And so it's very important to keep in mind that you're on these medications. You need to stay on it and not arbitrarily make a decision to stop. So, okay, now that we've covered some myths, we got to think about, what do we think about the aging process? Well, I like this quote from Mark Twain. If he actually said it, it sounds like something he'd say. Age is an issue of mind over matter. So if you don't mind, it doesn't matter. So I like that quote so much. I put it in blue or a light blue. And if you don't mind it, then it doesn't matter. And so I guess that means you come to grips with that process of, that passage of time. And but in reality, maybe there are times when we do mind and it does matter. So you have to change your mindset, really. And you have to make some conscious decisions about how you're going to live your life. And we do that throughout our 20s, 30s, 40s, 50s, 60s, 70s. Conscious decisions you make about how you're going to live, what outlook on life you're going to have. If something is there that needs to change, you make a conscious decision to change it. If something's missing, you look for some way to fill that void or to take care of what's missing. Or you slow down if you think things are too fast. So, or if you're doing too much, you take away so that you can enjoy life more versus feel being overwhelmed. I mean, that goes for all of us as we get older. So it's full of conscious decisions that you make. Any thoughts out there? I don't know if anybody Ron did. Any thoughts out there in Zoom land? Any reactions? I mean, these are myths, and I'll tell you what, depending on what sources you go to, there are different. I mean, I went for the most part to the National Institute on Aging, that's part of the NIH. And when I looked at different sources, there were different misconceptions and myths. There were dozens and dozens of them. So these are just 10. These are just 10. And I thought, holy cow, so I thought one could spend all day talking about myths and misconceptions on aging. But I thought this was a good area to cover briefly. And, it helps me think about the aging process in a more positive light. Everything seems harder to do as I get older. I want to say also harder to be enthusiastic about. I don't know about all of you, but you wish you had more time to do this or that without focusing on the here and now. Sometimes I'm thinking, I can't wait until I can retire from all this completely. But then when I think when I do get fully retired, what are my attitudes going to be like then? Because everybody's different. Everybody's an individual. Every individual has a different perception, idea about their life and aging and the processes that go with it. Every young person's going to be different. Every older individual is going to be, middle-aged person is going to be different. Others who are older are going to be different too. So that's another thing. Perceptions, every individual is going to have a different perception on these things. So I don't think there's any uniform perception in the end, which is good. I think that's a good thing. So anybody have anything out here they want to add about that? Yes.
You were talking about people having different perceptions, and actually the same person at whatever age they are will have a different perception within themselves.
Yes. I'm sorry, what is your name?
I'm Susan.
Susan mentioned that again, if I got this right, well, as we age, we'll have a different perception about aging within ourselves. Did I get that right? So I completely believe that, 100%. I agree. And I've noticed that over time within myself. A lot of my notions and ideas have changed. and I'm glad they have. I'm very glad they have. So very good point. Very good point. So here's a few websites, few that I drew from. There are others. There was one site I did not include on this, and I wish I had. That I think it is part of the National Institute on Aging, and it had so many different categories. I thought, oh my goodness, I wish. Maybe what I'll do is I'll see if I can pull that off my computer and add it as just a separate link to this next time I'm here, which I won't be here next week. Yeah, I'm still downstairs teaching next Tuesday and Wednesday, but the following week I should be here on Tuesday and Thursday again. So I can bring that link and maybe post it to because it covers a whole host of things regarding aging. I believe it is attached to the National Institute of Health. Yes. So with that, I'm done. So I think we're going to download the slides to the website. So they'll be there. And I think it's recorded too. I guess, I don't know, can I stop recording or can we stop recording? Okay.